This is our second edition of OmegaMatters, our omega-3 centric journal club from OmegaQuant Analytics and co-sponsored by the Fatty Acid Research Institute. We're happy today to have co-investigator on a recent, actually the lead author on a recent paper, Dr. Steve Farrell from the Cooper Institute in Dallas, Texas. And we're going to talk about a paper that Steve just published on omega-3 levels and heart rate recovery. So welcome, Steve.
Welcome.
Thanks, glad to be here.
Great. Tina, you want to take over?
Yeah. So today we're going to go over a paper that we at OmegaQuant collaborated with the Cooper Clinic in Texas on. And essentially, I'd like you to start with just talking about what the Cooper Clinic does and how we got this kind of data, just to kind of set the scene there, and then we'll go into what we were actually looking at with the heart rate recovery.
Okay, the Cooper Clinic is a for-profit preventive medicine center where people come from all over the world to have comprehensive physical exams. And we do a lot of different types of blood work, including the omega-3 index, but we also administer an objective measurement of the patient's cardiorespiratory fitness levels with a maximal treadmill exercise test. And this is considered the gold standard in terms of objectively measuring fitness as opposed to questionnaires where, you ask people how much they exercise and you may or may not get a correct answer. So the clinic has seen well over 100,000 patients over the last 50 years. And back in about 2007 or so, we began measuring the omega-3 index in our patients. And we decided in this paper, we know that cardiorespiratory fitness is a really important predictor of future health outcomes. But how the heart rate recovers following maximal exercise is also very, very important for cardiovascular health. And we call this pattern of heart rate following exercise heart rate recovery. So once a patient reaches exhaustion on the treadmill, we continue to monitor their electrocardiogram at 1, 3, and 5 minutes post-exercise. And the faster the heart rate recovers following maximal exercise, the lower risk there is of bad cardiovascular outcomes in that patient. So as an example, let's say you hit a heart rate of 185 during a maximal treadmill exercise test. And 1 minute into recovery, your heart rate was 165. We simply take the difference in those two numbers to calculate the heart rate recovery. So in that example, the heart rate recovery would be 20 beats per minute. The larger that number is, the better. And we also know that omega-3 levels in the blood, higher levels are associated with very favorable all-cause and cardiovascular outcomes. And we've known for some time that omega-3s have favorable effects on things like triglycerides and resting blood pressure and resting heart rate. And there had been a few studies looking at the relationship between the omega-3 levels in the blood and heart rate recovery, but those had been done on unhealthy populations, people that were post-MI, post-stroke, post-bypass, and so forth. So we wanted to look at the association between the omega-3 index and heart rate recovery in a group of healthy men and women, because the literature was really lacking on that association as far as data in healthy people. So that kind of set the stage for the current study that we're going to talk about.
That's wonderful. And I will plug, this is the paper. It's from, it's called Higher Omega-3 Index is Associated with More Rapid Heart Rate Recovery in Healthy Men and Women. And it was published in 2020 in Prostaglandins, Leukotrienes, and Essential Fatty Acids, which is the journal of ISFAL, basically. So it's very fatty acid focused, and we like it a lot. Yeah, that's a great setup for for this paper. And you've already gone over cardio. Is there more you want to say about cardiorespiratory fitness, or do you feel like you've pretty much encapsulated what you want to say?
Maybe just a definition for people that might not be familiar with the term. Cardiorespiratory fitness quite simply refers to the body's ability, specifically the heart, the blood vessels, the lungs, the ability of the body to transport and deliver oxygen to working muscle. In the laboratory, we use the term max VO2. Other people might use the term aerobic fitness or cardiovascular fitness. Those terms are all synonymous. We're basically looking at the body's ability to utilize oxygen. And about half of the variability in cardiorespiratory fitness is genetic. The other half is influenced by training. So it is possible to increase your cardiorespiratory fitness level with the right types of training. And it has an enormous impact, fitness does, on risk for cardiovascular disease, type 2 diabetes, and several types of cancer. So it's an extremely important component of health.
What are the units you apply for? How do you describe cardiorespiratory fitness? What's the unit?
Yeah, we put it in units of how many milliliters of oxygen can the body use per kilogram of body weight per minute. And we can measure that precisely in the laboratory. We can also estimate cardiorespiratory fitness with field tests, such as the Cooper 1.5 mile run, the Rockport 1 mile walking test, and so forth. So there are a number of ways by which we can either estimate or measure cardiorespiratory fitness.
So when people do it, they have a mask on with oxygen, controlled oxygen flow?
In a laboratory setting, you would be collecting and analyzing expired air. At the clinic, we calculate VO2 max based on the patient's final speed and the grade of the treadmill.
Oh, really? And going to exhaustion is not necessarily falling off the treadmill, right? It's, you just say, I'm done.
We don't let them hang on to the treadmill, and the signal that they want to stop is when they grab that front railing. And we do encourage them to give it a maximal effort, and most of our patients do. They're coming there for a preventive exam. They want to do well, so typically they do give it a very good effort.
Good.
That's good. Okay, so I think you've really set up a lot of the scene. So let's get into the data. We have omega-3 index levels on many people taken at the same time that they did a heart rate recovery test. So the primary findings were that the higher the omega-3 index, the higher the HRR value was. Like they had a greater drop in blood or in heart rate after their exercise. Is that correct?
Yes, and let's talk a little bit about the sample. One of the nice things about the Cooper Clinic is we tend to have pretty large sample sizes in our study. So for this particular paper, we had nearly 14,000 healthy men and women who had a maximal treadmill stress test and a measure of the omega-3 index on the same day. And what we did is categorize the individuals by their omega-3 index. As you folks well know, there are 3 categories for the omega-3 index, which is expressed as a percentage of EPA and DHA in red blood cell membranes. Less than 4% is considered low, 4 to 8% is considered normal, and greater than 8 is considered optimal. So we categorize the patients first by their omega-3 index and then look to see how the heart rate recovery, I will mention, although we measure heart rate recovery at minutes 1, 3, and 5, and all 3 of those data points are very important, the literature seems to suggest that it's the recovery heart rate at the 1-minute mark that is the most predictive of health outcomes. So yes, you're exactly right. We found that across the three omega-3 categories, we saw a more rapid heart rate recovery in both men and women. So there was a very a significant and beneficial association of the omega-3 index with a more rapid heart rate recovery. I believe we found that at minutes 1, 3, and 5 in both men and women. But again, the focus in the literature is especially on that 1 minute recovery heart rate.
Mhm. That's excellent. So I also noticed in the paper that people with higher omega-3 index levels, and this happens a lot, also had a lot of other healthy variables. Their lipids looked better. They had all these others. So how do you, is there an explanation why omega-3s would affect heart rate variability or heart rate recovery? Or is this simply a sign of a healthy person in general?
I think it may be a combination of both, although we do know that higher omega-3 levels in the blood seem to help the parasympathetic nervous system take over after exercise. During exercise, the reason we see increased heart rate, increased blood pressure, increased stroke volume, and so forth is because the sympathetic nervous system is dominating during exercise. What we want to see post-exercise in a normal response is that the parasympathetic nervous system takes over and really causes a rapid reduction in that recovery heart rate. And the omega-3s seem to be very helpful in that regard. In some way, they're helping the parasympathetic nervous system take over post-exercise to drive down that recovery heart rate more quickly. So there does seem to be a mechanism there. I think I also mentioned that in people with higher omega-3s, we also see lower resting heart rates and lower resting blood pressures, which would help further support the idea that the omega-3s are helping the parasympathetic nervous system not dominate, but more of an effect on the parasympathetic. So it helps us explain why people with higher omega-3 levels have resting heart rates and resting blood pressures and recovery heart rates that are better than people that have lower indications or lower omega-3 indexes.
Kristina, you make an interesting point because I think we saw very clearly in this, when you get a data set of 14,000 people, you can see a lot of interesting relationships. And I think in our table 1, we show that the older people have higher omega-3 levels and better fitness, which is kind of counterintuitive to what you'd expect. You would think, and of course our analysis is controlled for age, but there's that conundrum we see a lot in the omega-3 world where you'll see better outcomes with omega-3 levels being higher, and those happen to be in older people who should have more risk factors and should be at more risk for disease, but actually they're at less, which is interesting.
Mm-hmm. Yeah, and that.
Yeah. Yeah, we did see definitely better looking risk factors in people across the omega-3 categories. And I wanted to mention too, not only did we look at different omega-3 categories, we also looked at the omega-3 index as a continuous variable, which in plain English means for every X% increase in the omega-3 index, we saw a significant reduction or a more rapid reduction in that heart rate recovery during the first minute. So it didn't matter how you looked at omega-3s, either as a category or as a continuous variable, we found the same relationship. The higher the omega-3 index, the more rapid the heart rate recovery, which bodes well for people that are striving to increase their fish intake or take a fatty acid, a good quality omega-3 fatty acid supplement. So we think it's important for people not only to get their fitness level measured, but also to get their omega-3 blood levels measured, because both of those things are, part of the puzzle of how we get to good health.
I'm not sure how involved you are with the clinical care, but clinicians knowing this this information, how would that help their clinical care? How would that help them with their patients? Would you expect to see somebody increasing their omega-3 index to a therapeutic level and 8%? That would hopefully have them have better cardiorespiratory fitness down the line. Is that something that doctors at Cooper Clinic are counseling on?
Yes, at the clinic, one of the things that makes the exam kind of unique is the amount of time that the doctor actually spends with the patient following their exam. And definitely one of the things they look at very carefully with the patient would be not only lipid levels and hemoglobin A1C and so forth, but they're also counseled regarding their omega-3 index. And patients who are lower than optimal are counseled to consume more fatty fish and or take a fish oil supplement, because we really need to move those people. We need to move the low people at least into the normal category, and we'd like to move those normal category people up to the optimal. So for sure, the docs are counseling the patients to increase their intake of fatty fish and or fish oil supplements. And we hope that other clinicians would be doing that as well outside of the Cooper Clinic.
Steve, can I ask you a question about what does the doctor do to, in terms of counseling for a low cardiorespiratory fitness?
They are given an exercise prescription that is matched to their age, sex, and current fitness level. And for the general population, the current public health guidelines would be to accumulate at least 150 minutes a week of moderate intensity aerobic activity. So the patient is given examples of activities that qualify as being aerobic or cardiovascular in nature. And that would be any activity that includes major muscle groups, that also uses large amounts of oxygen, that can be done on a continuous basis, although it is okay nowadays to break your activity up into smaller chunks throughout the day. So we talk to them about how they should feel during exercise, or if they want to monitor their heart rate, we give them a target heart rate zone. And, the key is progression. For people that are very low fit, we want them starting off at, relatively low levels of activity. In other words, that 150 minutes a week, that's not a starting point for very inactive, low fit people. That's a goal that we want people to work up to, and it may take several weeks to reach that goal for people that are very sedentary and very low fit. Of course, there's nothing wrong with exceeding that guideline. There's nothing magical about the 150 minutes. In fact, if you look carefully at the guideline, it says a minimum of 150 minutes. So at least up to a certain point, more is better. There is such a thing as too much exercise, but the percentage of American adults that need to worry that they're doing too much exercise is infinitely small. The problem is at the other end of the continuum, we have tens of millions of people that are not nearly active enough. So they do get a detailed exercise prescription by the doctor at the time of their visit based on their treadmill performance, their age, and their sex.
Cool.
It's really great, the amount of data you guys get on people. I would say the other thing that I think that you've said that's really interesting is with the cardiorespiratory fitness, that half is genetics and half is lifestyle, essentially, and that there are several things in your lifestyle that you can do to help improve that fitness level. And one is obviously exercise. And it's nice to know that there are also some dietary things that can help along the way, help with making that fitness journey. It's almost like more efficient to get your heart working better. And I also like to think about things with the omega-3s that are more short term, that people might be able to measure on themselves if they have their own watches and things like that. Would they be able to do their own exercise and start to see trends in their heart rate or heart rate recovery themselves as they increase their omega-3 index in their fitness?
Absolutely. There are several field tests by which people can estimate their fitness level. So, it's not feasible for people to take maximal treadmill exercise tests every, 2 or 3 months to monitor their fitness level. But there are some great fitness tests out there that can be self-administered for people who are either overweight or injury prone. We would suggest the Rockport 1 mile walk test, and you can easily look that up online to see how it's administered. For people that are currently doing some jogging and enjoy running, the Cooper 1.5 mile run test provides a good estimate of cardiorespiratory fitness as well. So all it really takes is for both of those tests is an accurately measured area and heart rate monitor and a timing device. And both the Rockport 1 mile walk test and the Cooper 1.5 mile run test, provided people give it a good effort, both of those provide an excellent estimate of cardiorespiratory fitness. So you could simply self-administer those tests, say every 8 to 12 weeks or so, to see how you're progressing. Another thing that has a major impact, and I'm glad you mentioned the diet factor, simply losing weight, if you're overweight to begin with, will automatically have a beneficial effect on your cardiorespiratory fitness level, because muscular work is basically a function of force times distance. So if you're doing a weight-bearing activity, that activity is going to be a lot easier at a lower body weight than it will a higher body weight. So one of the ways by which people can increase their fitness level, obviously, is with aerobic training and maybe a little bit of interval training thrown in there. But if they're overweight and they can simply lose 5 to 10% of their body weight, it's kind of like 1 + 1 = 3. When you throw increased training and weight loss together, you're going to get a much bigger impact on your fitness level than with either of those components by itself. And today we know there's about 70% of the American public that fits into either the overweight or obese category. So weight loss is a big piece of the puzzle as well. And obviously that's impacted by diet. And we recommend that people follow the dietary guidelines for Americans, guidelines from the American Heart Association, American Diabetes Association, American Cancer Society. Those guidelines are all very consistent. So we discourage people very strongly from jumping on the bandwagon from the diet of the week or the diet of the month. Long-term, those fad diets are just not very effective for long-term weight loss.
Yeah, and I think all three of the dietary guidelines and the AHA both have a fish recommendation of about 1 to 2 servings a week, which we think would get people to around 5 or 6% on average. So it would get you out of the 4% range if you were eating fish twice a week. But probably
Excellent.
not.
Steve, let me ask you a question about the study again. What would you say to people that say that having the omega-3s really aren't doing anything? They're just a marker of a better diet, better health in general. So you really can't say the omega-3s are helping with the heart rate. It's just an ancillary marker.
Well, I would definitely push back if I heard that statement, because there is a lot of evidence that increasing your omega-3 intake either through fish or through supplements does in fact have an effect on both resting heart rate and resting blood pressure. So although our study was cross-sectional and it really doesn't show cause and effect, when you look at longitudinal studies where you increase people's omega-3 levels in their body, you do tend to consistently see a corresponding reduction, not only in resting heart rate and resting blood pressure, but also in things like triglyceride levels, as an example. So I think the evidence is pretty strong that it is causal in nature and not just due to an overall healthier lifestyle.
Great answer.
I have one more question. If someone's already fairly physically fit, but they have very low omega-3 levels, do you think increasing their omega-3 will help with their heart rate recovery even further?
Yes, I do, because one of the things we did, and we've seen in other literature, typically higher fit people have better or more rapid heart rate recovery than less fit people, but there are exceptions to that rule. In other words, some highly fit people have not so great heart rate recovery, and some low people have pretty good heart rate recovery. So although on average, fitter people have more rapid heart rate recovery, it's not a perfect correlation. And I do believe if someone is fit, highly fit, and they have a low omega-3 index, I think we could expect to see better, more rapid heart rate recovery if they increase their omega-3 index. I'm not certain that those studies have actually been done, but that's my gut feeling. I really do feel like the best possible scenario is to be highly fit with an optimal omega-3 index in terms of a lot of health outcomes, including heart rate recovery.
Yeah, there's a lot of athletes with really low levels. That's one thing we do see. So it'd be interesting to do that study. Well, we probably should wrap it up here. Any last comments?
We would just encourage people as a public health message to become familiar with the 2018, the most recent public health guidelines for physical activity, and to follow recommendations dietary-wise that are evidence-based. So the groups that we've been talking about, like the 2015-2020 dietary guidelines for Americans, American Heart Association, American Diabetes Association, American Cancer Society, those would be your go-to organizations for evidence-based nutrition information. And again, like you said earlier, all of those organizations, I think, are very consistent, encouraging people to consume at least 1 to 2 meals of non-fried fatty fish per week.
Mm-hmm. Simple.
And I would encourage people to get their omega-3 index tested.
That too.
Absolutely.
Yeah.
Along with their fitness level.
Along with their fitness.
You can do them all yourself. That's a
Do
cool
it at
thing.
home.
All right. Well, thank you so much for joining us and giving us such useful information. And hopefully we'll talk to you again soon.
Okay, enjoyed it very much.